to get started, there's a lot of challenges that we found out. And, from how individuals are collecting their data, challenges with their EMR, concerns that their administrators or key stakeholders really don't even understand what metrics to be collecting. I think that it's quite a variety of different challenges and barriers. And Danelle and Monica, I know that you have a few more to share as well.
Absolutely. I think some of the other pieces that we've seen is just, again, the mechanism, that the way that navigators are collecting data, because they may not have been educated on, one, the importance of metrics, and it's, as part of their role, but then the how to, because if you've seen one navigation program, you've seen one navigation program. As Tricia mentioned around the EHR issues, that's probably one of the number one barriers. And then the sheer volume of data that navigators are collecting. If we look at things like barriers that patients are facing, and if we look at distress screening, those are two data points that are collected very often from patients. So inputting that data, and if there is or is not a descriptive field, for navigators, just that time that they have to spend is just a few more of the barriers with metrics implementation.
I would agree with what Monica and Tricia outlined as barriers. And to go further, I would also state that looking at the defined process of navigation within one's own organization to understand where those data elements can be captured across the continuum. But it goes beyond that, and to look at where the data is being stored within the health system. Where's the navigator documenting their interactions with the patient? Where's the rest of the healthcare team documenting their interactions and their interventions? So it's critically important, Tricia alluded to this, to ensure that the right stakeholders are around the table when a program's coming together to, one, identify which metrics are appropriate for their program to measure, but then also identify where does the data live, so you can identify how you're going to capture that data and make it as automated as possible so that the lift is not manual data capture, but you try to automate that data capture.
And I wanted to add one more thing, because as they were collecting their data and they were realizing that, wow, that wasn't as good as I thought it would be in regards to the percentage or the number of patients touched, or how we were looking at and looking at the outcomes, we actually had to help them through performance improvement initiatives. So this is a snapshot of your data, but we want to enhance this data. We want to enhance your processes. So we did a lot of work utilizing the PDSA model to really help them excel. And actually every single performance improvement initiative, the teams did excel. And that was so important for us to share also for this toolkit as well too, because that was a big barrier. There were even some metrics that they didn't even feel were really associated with their role. So it was some really very important information that we had to discuss with these teams. But after we had those conversations, and after actually the administrators said, you know what, this makes sense and this is what we want to do with our program, there was a tremendous amount of advancement and success.
And I think to add just one more thing, as it relates to navigators and programs utilizing the toolkit, I think one of the best things, the entire toolkit is, I think, just a huge asset to the field of navigation. But the case studies that I alluded to earlier, for sites to be able to see, wow, this is a situation that we have been dealing with, and they can see from start to finish how they overcame whatever it was that they were trying to with that metric. So I think that is one piece amongst the many other valuable chapters within the toolkit that navigators and programs and administrators will see of great value.